Lip piercings, what you should know before getting one done. Coming up next on Consultations by a Piercer, episode number 28. For those who are new to the channel, welcome to the Body Piercing and Tattooing channel. Hope you're enjoying the videos. Hope you're finding them helpful and educational. But you might not know who I am. Maybe this is the first one you've seen with me in it. My name is DaVo. I'm a professional body piercer and have been since 1994. I own and operate the Axiom Body Piercing Studio, located right here in Des Moines, Iowa, inside Skin Kitchen Tattoo. So what we're going to talk about today is lip piercings. They are a piercing that is below the lip, usually referring to the lower lip. They can be done with jewelry that is circular or stud-style jewelry or something in between. And we'll get into that in depth today and talk a little bit about angles and etc. But that's coming up. First off, average healing time on this is going to be roughly anywhere from 8 to 12 weeks, sometimes a little bit longer, sometimes a little shorter, during which time I'm going to suggest at least throughout the entire healing period that you clean twice daily using a sterile saline, such as NeoMed's Piercing Aftercare. Basically, you just apply it to the area, let it stay in contact for roughly about 5 minutes, and then pat it dry twice daily. The other thing I suggest doing is rinsing in the shower at the end of your shower. Just basically kind of pull your hair and everything out of the way and let the water just flow over the area for about 30 seconds. What we're doing with those two things is we're trying to remove that hard, crusty discharge that collects on the jewelry. The crusties, everybody's concerned about. If it doesn't seem like those are coming off, I would suggest going and seeing your piercer and having them clean it for you, because there might be something else going on that needs a little bit of attention. Now, if you don't have the kind that comes out in a fine mist, what you want to do is compresses. Take a clean, sterile piece of gauze sponge or a clean paper towel. If you don't have that, just soak it up, spray it right on there until it's wet, and then just apply it to the area for about 5 minutes, and then pat dry. So that's the only two differences between the two. For the first 2 weeks, you do also want to do some rinses. I generally suggest rinsing with Biotene antiseptic mouthwash or an alcohol-free antiseptic mouthwash for about 30 seconds twice daily. Also doing a rinse with warm water and sea salt roughly a couple times a day for roughly about 2 to 5 minutes. Basically rinsing for a little while and then spitting. Both of those help with the healing, and they also kind of take the edge off things. The nice advantage to the Biotene is it also helps with dry mouth. Now it's time to move on to the things you don't want to do, the cross-contamination prevention. Common sense stuff Mom should have taught you. Wash your hands before you handle it. Try to handle it by the ends whenever possible, or the area of the jewelry that never enters into the piercing. No oral contact, deep mouth kissing, or sexual contact for a minimum of 8 weeks. That means none of that nonsense until it is completely healed. Also, even after the piercing is healed, understand that you are more susceptible to STDs during oral sex, so if you switch partners, practice safe sex the way you're supposed to. Don't stick unclean objects in your mouth, like pin caps, toothpicks, dirty fingers, other people's dirty fingers. Don't do that. Don't do that stuff. Keep your food utensils cleaned on a regular basis. Do not share food items or utensils with other people. It's a good idea to start with a fresh toothbrush, usually the night of the piercing, just to be on the safe side. Keep your environment clean. That includes clothing, bedding, towels, anything that may come in contact with the piercing. Do not submerge piercing in bodies of water you cannot control the quality of, which is pretty much everything but your own clean and well-maintained bathtub. Basically, in essence, no swimming. I don't care how well it's tested. I don't know how well it's treated and what have you. The reality is it is a standing body of water, and there are probably microorganisms in that water, which means that they can get into that open wound that you've created when you got pierced. Keep pets away from it. Don't let them sleep in the bed with you, especially the smaller animals that like to sleep up by your face and steal your breath while you're sleeping. Now let's talk about trauma, swelling, and abuse. Abuse. Don't sleep on the piercing. Make sure you're sleeping on the other side or your back, or figuring out a way to elevate it off the bed. Usually with oral piercings, like lip piercings, kind of having the pillow somewhat off to the side and behind it will keep it elevated off the bed. I've also had clients that for one reason or another, sleep flat on their face or on their stomach, have done use massage tables during the healing process. Seems a little overboard to me, but hey, that's a possibility. Do not spin, rotate, or move the jewelry during the healing process. There's absolutely no reason for this, and it's probably going to cause issues. It is not a fidget spinner. Leave it alone. Also, don't play with it. It's a natural human instinct to move around things with your mouth or chew on jewelry. Don't do that, especially during the healing period, not only because it's going to cause agitation that's going to lead to swelling and possible other problems, but also because it's going to help damage teeth. So stop doing it. First couple weeks, it's a good idea to stick with soft foods or uncomplicated foods. This piercing is not going to affect eating and talking as much as, say, a tongue piercing does, but you have to understand that any additional movement is probably going to lead to more swelling, which we're mainly concerned about during those first couple weeks. Eat slowly and carefully. Take your time. If it takes you half an hour to eat a meal, it takes you half an hour to eat a meal. It's better than chipping a tooth or getting the jewelry caught and dealing with the pain that's going to involve. As I mentioned before, reduce talking as much as possible. Movement of the mouth in any way, shape, or form, especially the first 3 to 5 days, is probably going to increase the amount of swelling you see. Cut down your intake of tobacco, alcohol, cannabis, hot and spicy foods, things that are extremely warm in temperature, vaping, or anything else that may agitate your mouth. If you ingest something and it hurts to do that, don't do it. Plain and simple. Things you also want to stay away from is citrus drinks or foods that are high in acidic or very acidic. Also, carbonated beverages. The bubbles aren't going to feel good. You know, things like soda or pop, what they call it in the Midwest here, or even beer, etc. That fizziness is going to cause some issues. So stay away from it. It's best to stick kind of with a soft food diet or a simple soft food diet. Things like yogurt, smoothies, sports shakes, nutritional shakes, baby food, applesauce, and then slowly wean yourself onto solid foods. Like I said before, this is not going to impact things the way a tongue piercing does, but it really is best to kind of start out slow and get used to having that jewelry in there and avoiding it. Keep in mind that because you're going to see swelling, we have to put in this longer post, so it's going to have more contact with your teeth and more likely to catch. That'll go away once you downsize to a shorter piece, and we'll get to that later. You can also reduce swelling by eating lots of cold items. Gently sucking on cold, crushed ice is a good idea. I generally suggest leaving the shop and going directly to a convenience store and buying a giant cup full of crushed ice. Drinking lots of cold liquids, especially throughout the night when you naturally dehydrate, will help too. Popsicles, ice cream products, anything that's cold is going to feel good and help reduce that. Additionally, sleeping with your head elevated above your heart will help reduce some of the swelling that you're going to see. And if you have never had any problems with it, an over-the-counter anti-inflammatory will help somewhat. When in doubt, talk to your doctor. I can't prescribe things or suggest things as far as medication, but it may help. Usually with this one, with lip piercings, you don't see swelling right away. Sometimes it takes a day or two for it to form, and then suddenly out of the blue, the thing's 3 times its normal size, and it looks like you got in a prize fight. Don't be tricked by this. Don't think like since you haven't seen any swelling the first day and a half that it's okay to go out and eat anything you want to and do anything you want to, because it will probably bite you in the butt that second day when you get up in the morning and suddenly it's a lot more swollen than it used to be. Risks. Now, with any oral piercing, you have risk of enamel erosion, gum erosion, and softening of the bones inside your mouth. This piercing is inside the mouth and outside of the mouth, and generally will have a lot of contact or possibility or risk of contact with front teeth. So it's very important the placement's correct and the jewelry is sized correctly, and you're wearing the correct style of jewelry in the piercing, and the angle is correct for that type of jewelry. The other risk is swallowing parts. This one, not as much so as like a tongue piercing. Usually when the ends come off of like a labret stud or, you know, a ring opens or what have you, you generally discover it long before you're going to be swallowing something. It's not like a tongue piercing where it's right where all the food is at and it just gets kind of lost in the process. But yeah, it's a good idea to check balls, make sure they're on there tight, and before meals, just to be on the safe side, and be cautious. Get used to it. Now let's talk about placement, angle, and jewelry. Now, there's kind of 3 types of jewelry that you can wear, mainly 2 types. and that's circular jewelry, and that's stud-style jewelry. Now, I generally, when somebody comes in and they ask for this for a lip piercing, I generally ask them right off the bat, what type of jewelry is your end goal as far as wearing in that piercing? Is it going to be a ring or is it going to be a stud? And if they say ring, I'll go, oh, do you ever plan on wearing studs in it? And if they say no, then we are going to do it at a slightly different angle and with different jewelry. For example, when we're doing it with a ring, it's usually better to kind of rotate the placement a little bit out of the mouth to more of a vertical angle, much like most people consider like a vertical labre, if you think about that, how it's that curved barbell with two balls. And then do it with either a curved barbell, possibly a circular barbell, or a ring. The problem with circular barbells and rings is there's a lot more movement, a lot more contact, and it's going to take longer for it to heal. Generally, what I try to do is suggest that you go with the curved barbells, then switch out to the rings once the piercing is well seasoned. Now, if you say, hey, I just want to wear studs in it, then labre studs are your best option. I suggest threaded. Threadless, I'm always worried that they're going to get caught in the thread. They'd be easier to swallow. They're not quite as secure as threaded jewelry, though I've had a few clients that have never had any problems with them. But yeah, generally, especially during the piercing process, we're going to do it with a labre stud, and we're going to do it straight in, 90-degree angle, so that that disc rests flatly against the inside of your mouth. Now, what about if you say, hey, I want to wear both of them? Then we're going to try to do it as high and as close to the edge, that ridge that's right there on the bottom of your lip, as possible. And I'm also going to explain to you that rings do take up more room. They're going to be more inside your mouth than a labre stud, and they may be uncomfortable. So we do the placement straight on, just like we would if you said, hey, I just want to put studs in it. But we also will do it a lot as high as we possibly can. If you're going to do a labre and you're just going to stick with studs, usually they're a little bit lower, just basically to either kind of keep it above the gum line or below the gum line. You don't want it directly right where the gum line is because it's going to cause issues. Now, as far as placement, let's just go over this very briefly. If it's going to be stud only, a little bit lower, straight through. If it's going to be both, straight through also, but a little higher, as close to the top as possible. If it's going to be flat out, you're going to wear circular jewelry in it, more outside the mouth, more at an angle that's going to be closer to where the smooth section of your lip meets the rough section of your lip, usually about 1/8 of an inch behind that. As far as placement, it can be anywhere on the lower lip. Usually, if lip piercings are traditionally more off to the side, and then are going to be involved, especially if you're going to involve some type of grouping. I really suggest, especially right off the bat, avoid piercing jewelry that has complicated ends. Sharp edges, points, things dangling off of it, really sharp edges. It's just going to increase the likelihood of those things getting caught on things and causing issues. Now, if you're piercing with a labre stud, especially, it should be oversized. Usually roughly about 1/8 of an inch or so larger than what's actually needed. We do suggest downsizing in 4 to 6 weeks to a shorter one, not only because it's going to limit the amount of movement and possibly limit the amount of possibility of rejection, or not rejection, but migration, but also to make it more comfortable and avoid contact with teeth and gums and all those things we want to avoid. With the curved barbells, usually they're pretty close to the size that we do. Sometimes they're oversized just slightly, but not much. They're usually a lot tighter than the labre studs are. One final thing on marking and placement, if you plan on getting a grouping, a bite, like let's say you want to do one, but you want to eventually have spider bites or snake bites or cyber bites or whatever bite, it's generally a good idea to mark those out when you are getting ready to do that first piercing. It's easier to move that first piercing now than to try to match it later and go, oh, yeah, I'm going to have to put this in the wrong spot. So have them mark both of them if you eventually plan on getting both of them done, just to be on the safe side. Now let's talk about pain in the piercing experience. Usually most people say on a scale of 1 to 10, this is between a 2 and a 4. It feels a little uncomfortable with the forceps. They pinch a little bit. It can be uncomfortable for people to be routing around in your mouth. Depending on the jewelry type they're using, it may take a little while for them to get that secure and get the balls and the ends on and everything where they're supposed to be. So yeah, it can be a little complicated. Usually right afterwards, you'll have some slight throbbing and aching, usually lasts a few minutes. Then it's going to be tender to the touch anywhere from 3 to 5 days. It may take a little while to adapt to having that jewelry in there. Any piercing that you do, there's a period of time where the body, where it just feels strange to have it. In places like the mouth, where you're in contact with it, it seems like it takes a little bit longer to get used to having it there. Sometimes you'll see a little bit of slight bleeding off and on, usually right after the piercing. These aren't prone to a lot of bleeding, but they can, especially with the more vertical style piercings. They tend to come closer to more blood vessels and be more likely to do that. Now let's talk about anatomy. Most people have the anatomy to get this piercing done because they have a lip. The only thing that may avoid or be an issue is if there's not space between your teeth and gums and your lower lip. If you have like an underbite, would be an option. It would be something we'd be concerned about. With those, you definitely want to do more of the old traditional lip piercing, which is more outside the mouth. That's used for like rings and curved jewelry, just to keep it away from those teeth of yours. Usually, though, otherwise, most people do have the anatomy for it. If you are kind of planning on having a grouping or bites, one thing you do have to understand is that each side of your face is slightly different, so the placement is more about matching to make it look like it matches than it is actually matching. So there might be some adjustments that need to be done and expectations when you get that done, because it might not work in the place that's going to look perfectly great for you, visually. Our biggest concern when it comes to anatomy is placement, and placement is placing it where it's going to do the least amount of contact with teeth and gums and cause the least amount of damage. Some things to consider. First up, there is no way you can hide this jewelry. Either you can try putting clear glass retainers in it, and etc. But the reality is, unless you have like a big giant beard, chances are people are going to notice the piercing. So if you are in a profession or involved in activities that are going to require you not to have it, it might be something that you want to wait until after you're done doing those activities or have a different job or are established in your career to get that piercing done. Don't be mad because you have to remove it. It's just part of the process of being an adult sometimes. If you're involved with sporting activities or other hobbies or after school activity or what have you, talk to the person in charge before you get the piercings done. Usually there is some form of dress code with any type of organized activity. Find out what that is and talk to the person in charge before you get it done, because nothing sucks more than having to take the jewelry out after you've gone through the trouble of getting it done. It looks great and you're really excited about it. Then you go to practice or what have you and they go, nope, can't have it. This can affect eating, especially possibly talking, not as much as, say, a tongue piercing would, off and on for the first week and a half. So plan ahead for that. You may need to change your diet, of course, as we talked about already. Downsizing. You're going to, like I said earlier, I suggest downsizing a shorter barbell and roughly 4 to 6 weeks. If you had it done, or labret stud, I should say, not barbell. Now, if you have any upcoming events like a dinner or a wedding or something, we're going to be doing a lot of eating, a lot of talking, you might want to delay getting this done until after that event is over. Keep that in mind ahead of time. Also, it's a good idea that before you go in and get this piercing done, that you go have a nice full meal, because you may not be able to eat the things you like for a couple days, especially anything other than soft foods. So go get that, scratch that itch a little bit. Now, if you're going on vacation or plan on going on vacation, I would suggest waiting until after you get back, mainly because you can't control how clean the environment is. And then, of course, there's the swimming issue. It's usually best just to wait until the vacation is over, then come back and get the piercing. Well, that's all I have to say on this subject today. Till next time, here's hoping the piercing seal with ease and without a single issue. And if you're in the Des Moines, Iowa area, I hope to see you for your body piercing needs in the future. Have a good day, everybody. Take care, and check out this other video.